The government today announced an end to almost all anti-COVID measures in the city starting tomorrow. These include the scrapping of mandatory PCR testing arrangements for all inbound travelers, the vaccine pass scheme, quarantine orders for close contacts of COVID patients, and the outdoor gathering limit. The mask mandate, however, will stay in place. Christy Kant reports.
2 days after the mainland announced major changes in its COVID-related policies, Chief Executive John Lee today declared an end to almost all anti-COVID measures in Hong Kong from tomorrow. The city's leader said the policy adjustments will help to fight the pandemic while allowing economic activities to take place. He added the government's efforts will now focus on reducing death and serious cases and protecting high-risk groups such as children and the elderly. One of the major changes include axing the mandatory PCR testing arrangements for all inbound travelers who are still required to perform rapid antigen tests for 5 consecutive days. The vaccine pass scheme, which was first implemented for all eateries and some regulated premises since February this year, will be scrapped as well. This means people no longer need to show their jab records to enter premises such as restaurants, bars, and cinemas. Quarantine requirements for close contacts of infected people will also be lifted. However, COVID patients are still subject to isolation orders until they obtain negative test results. Other social distancing measures, such as the 12-person gathering ban in public, a distance of 1.5 meters between 2 tables in catering venues, restrictions on restaurant capacity and some regulated premises will be lifted. And authorities will halt issuing testing orders for buildings. Chief Executive John Lee defended the changes despite the rising COVID caseload.
We have over 2.5 million who have been infected. So generally, we have built quite a strong community immunity against the virus. We have very good confidence that we can control the risk because the medical service has enhanced its response system, and also we have sufficient and effective medicine, and the community has good experience after 3 years to protect themselves.
However, one particular measure will stay in place, the mask mandate.
The benefit of masking, at least, especially at this point when we are facing a serious winter surge, is tremendous. We need to continue with the masking mandate in order to protect our citizens from the risks of not just COVID, but also influenza and other respiratory tract infection.
The Health Secretary added the authorities will keep the mask mandate until the city gets over the current winter surge. Christy Khan, TVB News.